Atma Namaste. Welcome to the session. Let us invoke for the divine blessings. To the Supreme God, Divine Father, Divine Mother, to our spiritual teacher, to all the spiritual teachers, all the great ones, holy gurus, masters, saints, archangels, holy angels, and spiritual helpers, to our higher souls and divine self, we humbly invoke for divine blessings, guidance, love, help, and divine protection. Thank you for your presence. Thank you for blessing us with your presence and deeper understanding Yoga Prana Vidya teachings. We thank you in full faith, so be it. Tathastu. Welcome to the session. Today we are going to discuss about healing subarachnoid hemorrhage and post-op cerebral vasospasm, a case study presented by Yoga Prana Vidya system. My name is Ganesh HR. I am a certified YPV healer and trainer. Let us go through the details of the case. So this is a research paper submitted by Yoga Prana Vidya, which is available at www.yogapranavida.com for your reference. Let us see the case. Subarachnoid hemorrhage. We call it as SAH for our ease of conversation. SAH refers to bleeding in the space surrounding the brain and its membrane. It usually occurs due to bulging or rupturing in the blood vessel of the brain. So SAH is one type of brain hemorrhage which happens. There may be different reasons for that. The most common surgery for SAH is clipping surgery done by making an incision on the head, temporarily removing a part of the skull. Definitely when brain hemorrhage happens, in most of the cases, surgery is the best suggested method medically. So they have to cut open a part of the skull and they have to find a bleeding region. They have to do the clipping surgery. But is there anything else which is connected with the SAH, or at the same time how Yoga Prana Vidya can be implemented in these cases? Let us go through the details. First, let us see the symptoms of a brain hemorrhage. Includes changes in vision or partial paralysis in one part of the body. It may lead to loss of hearing and memory. It may create seizures. There are multiple problems which may lead to SAH or which are being result of SAH. So in the name we saw two things. So subarachnoid hemorrhage, SH, and cerebral vasospasm, which is CV. What do you mean by cerebral vasospasm? See, it usually happens after the SH or even after the surgery which is conducted for SH. It is the restriction which happens in the flow of blood to different parts of the brain. It may be result or outcome or maybe a response which is coming from the body or the blood vessels to the surgery method which is followed. So cerebral vasospasm is where there is a obstruction which has taken place and some part of the brain is not receiving sufficient blood supply. So it may affect that part of the brain in different degrees. It may be a severe effect or it may be little lesser effect, but usually the effects are long lasting. Okay, so let us understand a crucial timeline in this particular case. We'll ease up our understanding. We'll divide it into three stages. The first one is the pre-surgery. See, in any SAH or subarachnoid hemorrhage case, the first and foremost important thing is to identify or diagnose that yes, it is an hemorrhage, because see, SAH can happen to any person. So it is not that it will happen to only certain category of people at certain age. No, it can happen at any point of time. Then the initial symptoms may be that they will have headache or giddiness. So that is a common symptom. It may be connected with many other diseases. So the crucial part is identifying or proper diagnosis of SAH, which definitely requires imaging. And then whenever there is a confirmation that yes, it is an hemorrhage, the second crucial part is to understand or identify where exactly the bleeding is happening. Once these two things are in line, then comes the surgery, which is the second most crucial part. SH includes, as we already told, clipping surgery method, which may normally takes like 6+ hours of surgery. It is a critical and long hour surgery. Definitely requires a lot of expertise in this field. Then comes the actual phase where patient is undergoing post-surgery recovery. Post-surgery includes reviving from the surgery, gaining senses. They have to be aware of their senses. They should be able to respond to the outer world. And then comes surviving the cerebral vasospasm. This vasospasm also happens after the surgery in most of the cases. And with respect to SH cases, post-operative CV takes more life or has more threat for the patient than the SH. So SH may take, it may be you can consider as 40% it is dangerous, but after surgery, cerebral vasospasm may affect the person in the 60% part. So it may be more dangerous or more negatively it can impact a patient even after the surgery. So cerebral vasospasm, now why it happens post surgery is because it is like there is a blood vessel and it may be a rupture, so which has led to the oozing of blood or releasing of blood. When the clipping surgery is done, that clip, even though it looks very small or minute, we can understand that, but still it will have an impact on the blood vessel where the initially blood was flowing. So because of the pressure which is built or which is now specially put on the blood vessel, it may reduce the size of the path. Then it will definitely affect the region where the blood was supposed to be flowing. And when the obstruction has happened, vasospasm has happened, all the areas which are affected in the brain, there are chances that that area may die or it may lose its ability to perform. Okay, so these are the timelines which are connected with SH cases. Impact of SH. See, subarachnoid hemorrhage is a critical condition. Definitely, it is connected with the brain where rupturing of blood vessel has happened in the brain. Blood is leaking and moving in the brain freely. Definitely, it is a critical case. It may lead to severe complications. Definitely, death is likely if not diagnosed properly at the right time. See, death of the patient is very, I should say, it is easy for a patient to die if not diagnosed at the right time, because blood can cover the different parts of the brain and it may be very difficult situation to manage. The intensity of the bleeding or the cerebral vasospasm may lead to coma. Person may get into the coma depending on in both sides, pre-operative stage and post-surgery stage. Both cases, person may get into coma, or there may be a permanent disability or loss of senses are also possible. So the issue need to be addressed at the right time in the best possible way. So that is the only solution which is there for subarachnoid hemorrhage and cerebral vasospasm cases. Cerebral vasospasm need to be monitored properly even after the surgery, and diagnosis of SH is important in the first part. See, what are the medical treatments available or the pharmacological approach which is there for SH? As we have seen, the most common surgery done for SH is the clipping surgery. So it is done by making an incision by removing one part of the skull. If the blood vessel is not clearly identifiable, then with the help of vessel bypass, an alternate artery is sewn in the area where the blood vessel is ruptured to give an alternate path for the blood to flow without causing the bleeding. See, there may be instances where the exact place or the exact point where the rupture has happened is not identifiable easily. Then there needs to be a bypass which need to be created. So this is also a part of the surgery which will be done. Complementary and alternative medicine approach which are there for SH, relaxation technique, post-operative. Definitely surgery is in most of the cases it is unavoidable. Surgery needs to be done. When we are looking at the recovery of the patient in the post-operative stage, relaxation techniques can be helpful. Physiotherapy definitely it will be needed to improve the mobility of the patient, because we don't know which parts are affected, and he has definitely undergone one of the critical surgeries out there. So it is possible that he need to be under a physiotherapy for a couple of weeks at least. Speech therapy, if needed, need to be done, because there is a high chance that their ability to speak or respond might get affected during the course of the treatment or surgery or pre-surgery stage. So that need to be addressed if at all there is a need. Let us see with respect to our case study, what is the details of the patient. Patient here is a 35-year-old male, experienced a severe headache, and he didn't have any previous history of hypertension and no family history of subarachnoid hemorrhage. Had an issue in an artery, as there was a tiny extension restricting the blood flow. So it is mostly kind of by birth there was a extra root present in the artery, so it was like a dead end where the blood was flowing, and because of the continuous pressure it got ruptured and opened. So it caused the SH, and he underwent a CT scan on day 2. So when it happened in the first day in the evening, he was admitted to the hospital, and then initially is why he got fainted or why he has a headache. So these things are tried to be administered. His BP was monitored, and when it was not under control, on day 2 he underwent a CT scan. Then he was diagnosed with SH, and definitely once the SH is diagnosed, he has to undergo immediate surgery. So he underwent an immediate surgery that lasted for 7+ hours. And the patient in the post-surgery stage, he developed a CV or cerebral vasospasm. And what Yoga Prana Vidya did in this particular case. See, YPV intervention has happened in all the 3 stages with respect to the patient: pre-surgery, during surgery, and post-surgery. Pre-surgery, we did healing, and during surgery, post-surgery, also we have done healing. In the post-surgery, additionally, what was done is person was made to do rhythmic yogic breathing and forgiveness sadhana slowly, like after a couple of days and couple of weeks. Then planetary peace meditation, and also the diet was suggested as like salt-free diet, fruit diet. So he was able to manage his diet, emotions, and physical well-being along with these practices, along with the medications and the post-operative physiotherapy and other things. Okay. So YPV intervention has happened in all these timings. The YPV energy healing. See, YPV or Yoga Prana Vidya is an ancient science and art of energy medicine. It is a process of renewing the energy body to bring changes in the physical body. It is used up energy. There are used up energy in the body which can be replaced with fresh energy to accelerate body's natural healing process. So Yoga Prana Vidya works on accelerating the natural self-healing capacity of the body. The healer channels and transfers the energy. The person who know Yoga Prana Vidya techniques is called a healer, who can transfer or channel the energy to the person who is in need of healing. So Yoga Prana Vidya is a complementary system. So it can be practiced with any other traditional medical systems or modalities. It is a complementary to all other healing modalities, including allopathy, homeopathy, or Ayurveda, Unani, Siddha, all these things. So it is a complementary system. To understand a little more about these aspects, see, there are different layers with respect to a human being. When we say a human being, it is not merely a visible physical body. It has different layers in and around it. The incarnated soul extends into 3 bodies, or when we say a person is born, that soul is extending its consciousness into 3 different layers: physical body and the pranamaya or energy body. So physical body and energy body, the first phase. Then comes the kamamaya or emotional body. The manomaya or the mental body is the 3rd layer. The one which is connected with physical existence, the one which is connected with emotional existence, and the 3rd one which is connected with your mental attributes or thinking process. So when Yoga Prana Vidya healing is applied, and when the person who suffered SAH, subarachnoid hemorrhage and cerebral vasospasm, underwent the course of treatment as suggested by Yoga Prana Vidya system, there are some fantastic results which we have seen. See, the person recovered from the surgery within 4 hours, and he was able to recognize people, and he was in his senses. He was able to move limbs, and he was able to feel his physical body very easily. So he was in sound state of mind. He was able to look at the people. He remembered those people. So his memory was intact. His senses were at right control. And he managed post-surgery cerebral vasospasm without any serious complications. Like, he was monitored for the CV. Son was after the surgery, he was monitored for cerebral vasospasm. There was a CV instance which happened, but he was able to manage that without any serious complications. So as we discussed earlier, CV can also have a serious complication like death, or a person may get into coma, or permanent or partial disability, losing of senses. So different possibilities are there. But in this case, the person was able to manage without any serious complications, and he got discharged within 14 days because the person is expected to be there in intensive care unit for 10 to 14 days in case of subarachnoid hemorrhage case, post-operative cases. But in this case, he got discharged within 14 days from the hospital, and he resumed his daily chores, and he joined back to his job or work in 2 months. She was able to manage with his mobility and all other things in a fantastic manner very easily. And the fantastic outcome which happened is the whole family learned Yoga Prana Vidya Healing, because see, they have witnessed that yes, Yoga Prana Vidya Healing has helped the patient in these aspects. So they were able to understand how effective it can be and how helpful it can be in managing their health conditions in the future. Okay, so the whole family learned Yoga Prana Vidya Healing after this particular case. Okay, so you can go through this case study in www.yogapranavida.com. It is available. You can go through a lot of other case studies also which are available there. And let us wait for a couple of minutes to see that if there is any questions you have. If any question is there, then definitely we'll answer it with respect to the case or the paper which we have discussed. Okay. How does healing helps if done during the surgery? Okay, see, Yoga Prana Vidya healing is a no touch, no drug therapy, and most of the healers do follow distance healing technique. So even though surgery is being done, at that time also you can do healing to the patient, and it is helpful in making sure that all the energy centers or the flow of energy is smooth and they're happening in a balanced manner, so they are maintained balance, so it which in turn makes sure that the person is not having any adverse changes in the body. It may be like sudden variation in the blood pressure also. So healing a patient during the surgery will help in his post-operative recovery, as in this case only we discussed. Within 4 hours, the person was able to completely recover from 7+ hours of surgery. Okay, so that much surgery, pretty long surgery was done, but still he is able to recover from that in a fantastic manner. So in the same manner, it may be any surgery, maybe a minor surgery or a major surgery. If the healing is done during the surgery, then the complications are less, and you can definitely at energy level complement the surgery or surgical procedures which are done by the medical practitioners, and it will be helpful in recovery of that patient. Okay, so and there may be instances where lot of parts are involved, or it may be like cases where there may be ups and downs which happens in the condition of the patient during the surgery. Okay. You can avoid most of these small issues which may happen during the surgery. And what happens, lot of contaminated energy gets released during the surgery, which can be handled better then and there if the healing is done along with the surgery. It is suggested that whenever a person is supposed to undergo surgery, they can take help of Yoga Prana Vidya healer in this case. Okay. Yes. So can we prevent SAH or any such hemorrhage using the Yoga Prana Vidya techniques? Yes. See, any brain hemorrhage happens because of 2 reasons. One which is under control, which is in our terms, and there may be few reasons which are not in our control. Like the one which we discussed today, this case was not in the control because the person was unaware that there is something which is not right in the brain, in his brain. Okay, but there are cases where it can be in control, because what are the other cases, like other reasons for SH, hypertension, which can be administered by Yoga Prana Vidya healing, and it is like alcohol consumption, smoking, all these things, or in one word you can say addictions. So addictions can be controlled or administered better using Yoga Prana Vidya healings. So your lifestyle can be managed better with the Yoga Prana Vidya. If that is done, then definitely you are reducing that risk of getting into not just hemorrhage but any other serious health condition. Okay. So you are giving a space for good health over the other part. So you can definitely help in this part. You can help yourself using Yoga Prana Vidya healing. Definitely, it helps in prevention of any serious health condition. So Yoga Prana Vidya is a preventive and complementary system. So it will definitely help. Are there any other neuro cases or other type of cases documented where YPV healings were helpful? Yes, Yoga Prana Vidya has like a number of cases, more than say 60, 70 published research papers are there, which you can go through in yogapranavida.com. You can go through all the details, and there are it is not reserved to one type of health problems. So we have like seen cases which are connected with almost all organs in the body. So it can be your brain, heart, kidney, lungs, any other system you take, any other parts you take. There are cases which are documented evidences on this. So that means Yoga Prana Vidya is helpful in administering top to down the entire body, including psychological aspects. Okay. So Yoga Prana Vidya is helpful in managing physical and psychological health issues in a fantastic manner, and not just humans. Even Yoga Prana Vidya has cases which are connected with animals. Okay, so anything which is living can be healed using Yoga Prana Vidya system. Okay, so that is about the case study today. So you can go through these things. For more details, definitely have the links available. You can contact us at the given numbers, and for more details, definitely you can log on to yogapranvidya.com. Thank you so much for your time in listening to this session, and hope this was informative, and all the people who are witnessing or going through this video, if you have not done Yoga Prana Vidya courses, or if you have not learned Yoga Prana Vidya, definitely connect with the system. You will not regret your decision of bringing Yoga Prana Vidya into your life. Wish you all the best, and let us do the Thanksgiving. To the Supreme God, Divine Father, Divine Mother, to a spiritual teacher, to all the spiritual teachers, all the great ones, holy gurus, masters, saints, archangels, holy angels, and spiritual helpers, to our high souls and divine self, we thank you for the divine blessings, guidance, love, help, and divine protection. We thank you for your presence. Thank you for blessing us with deeper understanding of Yoga Prana Vidya teachings, and thank you for blessing us with the opportunity to know more about the research paper presentation. We thank you in full faith. So be it. Tatast. Thank you so much. Signing off, Ganesh HR.